Hi, everyone. My name is Dr. Pooja Yaramilli. I'm currently a health specialist at the World Bank and an assistant professor of medicine at Johns Hopkins Medicine. Previously, I've worked across a range of organizations spanning the WHO, NGOs, academia, and CSOs to improve health equity locally and globally through a focus on public health and health systems financing. At the World Bank last year, I had kickstarted a global knowledge program on health workforce. So, in relation to this, my leadership project focuses on mainstreaming a gender lens in the World Bank's engagements on health workforce. Health workers are the backbone of the health system. They are required to deliver essential health services and universal health coverage, pandemic preparedness, and climate resilience. And because women comprise of almost 70% of the health workforce, for years now, there have been global calls to action to integrate a gender lens into health and care worker investments and policies. But how to meaningfully do so on the ground has remained fraught, primarily due to issues that have long plagued global health engagements. Efforts have been short-term and fragmented, and have primarily treated health workers as inputs into the system, as opposed to human beings working in complex environments. So as a result, there remain tremendous bottlenecks in health labor markets, including significant paradoxical unemployment of fully educated and trained health workers where they are needed the most. And though we generally know what these bottlenecks are, we lack concrete evidence and practical guidance as to how to successfully characterize and address the needs of women to truly elevate them. At times, this has resulted in unsuccessful attempts to translate global calls to action into reality. For example, in some countries, the translation of global calls to professionalize community health workers has inadvertently led to the masculinization of this cadre because the specific circumstances facing women and their ability to access professional opportunities writ large were not taken into account into policies and programs. So in this context, the World Bank's Global Knowledge Program on Health Workforce that I kickstarted last year aimed to fundamentally shift from siloed, fragmented efforts towards systematic, human-centered approaches, and my leadership project aims to meaningfully mainstream a gender lens into this effort. To this end, my leadership project aimed to integrate a gender lens into key health workforce analytics in key countries, including on the impacts of health worker on and underemployment on health and human capital, national policy options to improve the quantity and quality of job opportunities, and cross-border policy options like bilateral labor agreements for women-dominant cadres such as nurses. But because the what is just as important as the how, in order to achieve replicability and scale, there are two project outputs. One, a country-level technical report on strengthening the health workforce, which integrates a gender lens, and two, a brief which synthesizes the process by which a gender lens was integrated and how this can be adapted for future work in other contexts. In terms of how to go from the activities to outputs and outputs to outcomes, I have pursued first and foremost internal and external multi-sectoral collaboration, including with gender specialists, from start to completion of the projects to ensure buy-in and ensure and strengthen the approach and impact. I've also obtained gender disaggregated data. I've integrated human-centered approaches in qualitative data collection and design. And I aim to amplify the key insights that are ultimately delivered through internal and external dissemination. Currently, while all of this work is still underway, the main insight I wanted to present from the process of conducting my leadership project is the importance of flexibility and agility to adapt to achieving impact in this hyper-evolving landscape. In the context of larger global instability, we have seen shifts in country priorities, how we as the World Bank engage with countries, and our own priority agendas and accountability mechanisms. And while these have introduced challenges, they have also presented new opportunities to amplify the impact of my leadership project. For example, through establishing and increasing its relevance to country priorities and our own corporate priorities on, for example, universal health coverage, our works initiative, and our jobs agenda. In closing, it was really the process of going through this leadership journey that allowed me to embrace uncertainty and the opportunities it brings, rather than shrink in the face of its challenges. And in large part, this is because I did lean into my identity and the unique perspectives I bring through my various intersectional perspectives. In terms of my next steps, I still plan to complete the outputs and share key learnings by the end of this calendar year. But the main macro next step is to maintain and strengthen my internal and external community and relationships, including with Women Lift Health, because ultimately it is mutual trust and support that will enable not only the success of my leadership project by fostering collaboration over competition in this time of intense scarcity, but also my continued professional and personal growth, even in these uncertain times. Thank you for listening, and I'll take any questions or comments.